Hello friends, this is Dr. Rajkumar saying a big hello to you. Welcome to our channel for education, information and a little bit of entertainment too. Right, so in this segment, this edition, I'm going to be speaking to you on something that frequently comes up. What is the current position of bariatric surgery in India and specifically in Chennai? It was April 2nd, 2002. I performed South India's first laparoscopic gastric bypass on a young girl who was about 30 kilograms overweight. So long struggle, and she did very well. And in the next year, the entire year, I did only 2 such operations, whereas now there are at least 5 or 10 or 15 centers in the country that are doing well above a couple of hundreds of such operations every year. So bariatric surgery obviously has grown from 2 a year to 150 or 200 a year in the intervening 12 years, and that is one hell of a long time, and there's one hell of a huge growth in that long time. Why has this growth happened? I believe that in India, especially in the metropolitan cities and especially in the north, there's been a great rise in awareness of what bariatric surgery is. It's not a gimmick anymore. It's a surgery that can correct your metabolism. It's a surgery that can bring down your cholesterol, your diabetes, your blood pressure, prevent you from having knee operations, prevent you from having heart operations. I always joke and say, when you do a bypass, you bypass a bypass. That is, you can bypass the coronary bypass by having a gastric bypass. And not only will you be saving yourself multiple operations and a lot of money, you will be healthy, much more handsome and much better looking and much better equipped to run through life. This perspective comes from me because we are one of a handful, a cluster of centers across the country where we do virtually the entire spectrum of bariatric surgery, starting from a band or a sleeve or a gastric plication all the way up to complex procedures like ileal transposition and biliopancreatic diversion or duodenal switch, and of late revisional bariatric surgery. Now that brings me to the last part of my talk. In India, revisional bariatric surgery is on the rise. If you look at the last 12, 13, 14 years, a number of patients have had bariatric surgeries, some appropriate and some perhaps not so appropriate. I'm not commenting on that, but for whatever reason, when there is weight regain or some complication of the bariatric surgery, then the experienced surgeon comes in to perform what is called revisional bariatric surgery, in which you have to actually revise what was done and pull the chestnut right out of the fire, pull the patient out of a crisis. Thus, bariatric surgery in India has been spearheaded by a small group of surgeons called OSSI, or Obesity Surgery Society of India, and I'm one of the proud members of this society, and we get together and we've had a number of very successful conferences. I'm also very happy and proud to say that I was the organizing chairman for the Obesity Surgery of India conference way back in 2007 itself. And again, in the intervening 7 to 8 years, bariatric surgery has not been steadily marching forward. It's been surging forward in leaps and bounds, mirroring the growth that we have been seeing across Asia and Korea, China, Singapore, Malaysia, etc., and across America. Only in the United Kingdom, the growth of bariatric surgery is much slower because of its National Health Service, NHS trust issues, but in the rest of the world it's growing at a phenomenal rate. Thus, with actors, industrialists, I'm not mentioning any names, politicians, I'm surely not mentioning any names, are all taking it up in a big way. The middle class person also is accepting bariatric surgery today in Chennai and in India, perhaps not as much as they should be. I still believe that for 10 people who should have the surgery, only 2 of them have it. However, bariatric surgery, my dear friends, has come to stay today in India and is here for the long haul. To learn more about such things, please do subscribe to our channel and participate with us and enjoy the art, the science, the skill and the craft of medicine. Thank you very much.